So I had a case of peripheral neuropathy that was extremely hard for me to resolve. And she wasn't a diabetic, not a smoker, drinker, no chemotherapy, radiation therapy, but she had this constant burning pain on the top of her feet specifically. And we've been going through treatment for probably the last 2 months. She gets better sometimes, but not always. And then these last couple of weeks, she was doing a little bit rough, and she was kind of back to square one. She was so frustrated, and so was I, because I couldn't figure out what was going on. And then after diving into it, what we found is that when she works from home, she sits on her feet. So she actually has pressure on the top of her feet. And what this was causing was what's called a superficial peroneal nerve entrapment. And we started working manually on that, got her to stop from sitting on top of her feet. So that looks like when she's sitting down, she's tucking her leg in under her. And if you look at that, that pinches that nerve exactly. And once we got her to stop doing that, once we started working on that nerve entrapment, guess what? She could actually sleep again. The pain was a lot less. And she's like finally got hope now. But the thing is that I really want to make a point in this video is that it just takes a lot of time and a lot of effort to figure some of these cases out, because they're complex. Like, there are so many factors that go into it. And it took me, and I see cases all the time, but this was kind of that 1% of cases that was just something off the wall that you just never know about. And so this is where consistency and just reevaluating the patient or yourself or whoever it is really sets apart a successful case versus a case that, well, we don't know. Here's a medication or a pill and we'll see you later. Hopefully it gets better. If not, we can try more, but that's really all that we can do. So, and I've done consults with a bunch of people lately from all over. And some of them I can't help from a virtual standpoint, but some of them I can. But, at least they're getting guidance on where to go. I haven't had anybody who's been upset, because they always get some value from our meetings. So if that's you, if you're struggling with your neuropathy, there's a link in my profile. You can go on there. You can book a consult to see what's going on. And then from there, I can tell you whether I can help or whether I can't, or give you some guidance. So hopefully this helps. Sorry this got a little bit long in the tooth, but thank you all for all of your support, and I'll see you all soon. Bye.